Operating room management is a science of how to run an operating room depending partly on the types of patients receiving care. AHH OR004 or Patient Acceptance in OR has become the theater's guide in receiving patients. Patients being received in OR for surgery are properly identified. All necessary documents such as consent is being checked and receiving nurse sees to it that the patient for surgery is properly prepared using the preoperative checklist as their guide.
Good morning, I'm Elsa with the patient ID.
Okay, Madam, good morning. What is your complete name?
Jenna Arita B.
1496866. And do you know your doctor?
Dr. Sansan.
And your procedure?
Appendectomy.
Okay. Do you have any contact lens?
No.
Dentures?
No.
Everything removed, Madam?
Yes.
Okay.
Patient Laarni Caldit Rien with file number 1496866 for appendectomy under Dr. Sansan with consent signed by the patient.
Okay. Area shave?
Yes, and mark. Okay, check.
Madam, we'll just check. Okay.
With blood pressure of 100/70, pulse rate 86, RR 19, and weight is 63 kilograms. Temperature is 37.2. With IV cannula at right metacarpal vein. X-ray. With X-ray.
Okay. Blood requested?
No.
Okay. Latest hemoglobin?
13.7.
NPO?
NPO at post-midnight. Then prophylaxis given.
The first and most important component of peri-anesthetic care is the continuous presence of a vigilant, professionally trained anesthesia provider. The provision of safe anesthesia care depends on the careful preparation, which is facilitated by a systematic review of patient, machine, equipment, and medications. Pre-anesthetic assessment also includes checking of site marking, any risk for severe blood loss, any known allergy, availability of essential imaging, and making sure of equipment sterility.
Dr. Kalash, good morning. Patient's file number 1496866. Madam, what's your name? Laarni Bien Calvi. For appendectomy doctor under Dr. Sansan. Patient's initial vital signs, BP 11768, pulse rate 83, respiratory rate 18, SpO2 100%, temperature 36.8 degrees Celsius, and weight 63.5 kilograms, doctor. Patient is conscious and seen by Dr. Magdi and is fit for anesthesia. IV access available with gauge 20 inserted at left metacarpal vein. Patient has confirmed identity, procedure, and consent signed, doctor. Marking was done. Do you anticipate difficult airway or aspiration risk, doctor?
No.
Anesthesia equipment and medication check and is functioning. No known allergy, doctor. Do you anticipate major blood loss of more than 500?
No.
Equipment sterility and indicator check. Check. No essential imaging available, doctor. Senasef 1.5 given as prophylaxis.
The surgical timeout is the phase after induction of anesthesia and before skin incision. It is actually recognized as an opportunity for the surgical team members to communicate effectively to lower down the risk of wrong site, wrong procedure. Okay, during this phase, the surgical team introduces themselves. We reassert antibiotic prophylaxis if it is given as ordered. And during this phase, we also identify the patient, the site, and the procedure to be done. We also discuss anticipated critical events such as major blood loss, hemodynamic instability, and other morbidities.
Good morning, Dr. Sansan, Dr. Kalash.
Good morning.
I'm Mylene, your surgery team.
And I'm Annalyn, your scrub nurse.
Shelly, anesthesia nurse.
Dr. Muhammad Kalash, anesthesiologist.
Doctor, your patient's name is?
PM Naan
What is your proposed procedure, Doctor?
Appendectomy.
And any anticipated critical events like major blood loss?
No,
Other morbidity, Doctor?
no.
Dr. Kalash, is the patient stable?
Stable.
Antibiotic prophylaxis given.
Surgical sign-out. The period after the skin closure and just right before the patient will be transferred to recovery room. During this phase, the scrub nurse will give the final counting of the sponges, sutures, and instruments, and the circulating will ask the surgeons as to the site and operations performed. If there is a specimen, we ask as well the surgeon if it is to be sent for laboratory or just to show to patient. As well, we ask for the equipment problems and any concern for recovery.
Okay, operation ended at 10 a.m. Dr. Sansan, can you please confirm your procedure?
Confirm appendectomy.
Doctor, all count of sponges, instruments, and needles complete.
Dr. Sansan, any specimen?
There is appendix for the patient room first, and then the sofa.
Okay, any equipment problems?
Nothing.
Anesthesia care unit, or in the PACU, it is where we take care of patients immediately after surgery until the time that the patient is transferred into the ward or another unit. So what we do there is we monitor the patient's vital signs closely, we observe them for any untoward post-anesthetic reactions, and we ensure that the patient receives the proper pain management and treatment depending on their condition and also depending on the anesthetist order.
Endorsing patient with file number 1496866, named Laarni Bien.
Yes.
Status post appendectomy under Dr. Sansanyot and Dr. Muhammad Kalash. Here is the specimen. Appendix. Patient first, then is the pack. For the dressing, we have steri strip and oxide. For okay, we have the doctor's order, NPO for 4 hours, then clear fluid when fully awake. Drugs are started. Thank you.
Endorsing patient, call number 1496866, Laarni Bien. Post-op appendectomy under Dr. Sansan, Dr. Kalash. IVF LR 500 ml. Receive is 300 ml. Total IVF infused 800 ml. Patient, ASA1, GA by EDP. Solio 100 milligrams, Dexa 8, then reversal given. Latest VS, BP 11868, heart rate 76, SpO2 100%. Thank you.
Thank you. Doctor, if the patient complains of pain, anything to breathe? Okay, thank you.
Morning. Endorsing patient, file number 1496866, Laarni Bien, patient of Dr. Sansanyut and Dr. Muhammad Kalash. Post-appendectomy, GA by ETT with ongoing bottle number 5, LR, remaining of 400. Total intake in RR is 600 ml with petidine IV given around 3:40 p.m. No catheter with specimen, appendix to patient.
And we were passing time, getting high with the best friends, living life, eating right, learning lessons. Didn't need no struggle, we were good for life. We didn't need no place to rest our awfully burdened heads. Back then the air was fresh and we were good for life. We were just kids. We were just kids. We were just kids. It is what it is. We were good for life. We were just kids. were just kids.